Project Access gave us the flexibility to really do innovative things that we weren't able to afford for ourselves, but have always been in the back of my mind as difference makers to achieving the impact that I know we can do for our communities. So one of the things that we've done with this is we've successfully recruited 2 dentists, which we were in desperate need of. We have a mobile unit, and we use that for high poverty schools and also nursing homes to do outreach in the communities of high need. We were treating anywhere from 6 to 15 cavities in one child at one time. But it's now the cleaning and the fluoride varnish, and we move on. And that's what you want, is a lifetime of health for these kids. The X-ray was a wonderful opportunity to add that, and that was one of our first ideas. We had built the room and we couldn't necessarily afford the equipment. And so this allowed us to get the equipment, and so it's been a huge difference maker. So we have the living quarters that we have added, where we offer an apartment. It's intended for long-term growth for our facility to really offer housing for students in their last year of education. I'm really proud of what we've done here.
Project Access was a godsend. There's probably 3,000 more patients that are accessing our services, and I think that's because we have the best and brightest talent, because we have the ability to retain them. There's a big investment in infrastructure to help grow the access to behavioral health, and that's where we've invested a portion of our Project Access dollars. Raising money in the community is really hard. This was a gift that seemed to fall from the sky. That's the joy of Project Access, is that we get to choose where we need it most.
The 7 Nebraska federally qualified community health centers from Omaha to Gering serve over 123,000 Nebraskans. We are eternally grateful to Nebraska Total Care and the Centene Foundation for making Project Access what it is today. It's our goal to meet our patients and our families, and ultimately Nebraska Total Care members where they're at. And these Project Access dollars are so important to this mission.
Project Access is important because it has brought key funding that has allowed for the recruitment and the retention of clinical and dental professionals throughout the state of Nebraska, that has increased the capacity of our federally qualified health center partners to serve more Nebraskans across the state. Those folks may not have otherwise had access to health care without the support and the funding of Project Access.